Hello and welcome. I'm Kaprice Crawford, the Education Manager here at the Home Furnishings Association. Today we're talking about an option that's changing the game in health benefits, the Individual Coverage Health Reimbursement Arrangement, or ICHRA for short. Now joining me is Branson Proctor, the ICHRA Senior Vice President at Decisely, HFA's Healthcare Solutions Partner. Branson has helped many employers navigate this approach. And over the next few minutes, we'll cover what an ICHRA is, how it works, and why it could make sense for your small business. Well, Branson, let's start with the basics. What exactly is an ICHRA and why should our association members care about it?
Absolutely. And thanks for having me, Caprice. It's a joy to be here talking with you. So ICHRA, okay, it is an acronym, one of many that we have in the healthcare industry, and it stands for Individual Coverage Health Reimbursement Arrangement. Okay, employer groups that we deal with probably have heard of an HRA before, but this specific setup came out of some legislation in 2020 that enabled this specific vehicle to be an ACA or Affordable Care Act compliant employer sponsor solution for businesses of all sizes, whether you have a staff of 3 to 4 or if you are over 100 and plus. And so the reason why this is, now emerging as not just a trend, but also now a viable strategy for employer groups of all sizes, is because it offers more flexibility and predictability to our employer groups. And we'll elaborate more on that. But also on the employee side of the aisle, it offers more freedom and choice. Okay, and so really what this arrangement does is an alternative to the traditional employer-sponsored model. The traditional model being, an employer group, Mr. or Miss Employer works with one insurance carrier, to name the big ones, Blue Cross Blue Shield, United Healthcare, Cigna, or Aetna, and they enter into a 12-month contract or a policy period with that one carrier. The employer group also chooses the medical plan designs on behalf of their employees that they're going to wish to offer to them and make available to them. And there's certain, I'll call them speed bumps that these employer groups have to meet to even get that sort of traditional plan off the ground, such as minimum participation requirements, minimum contribution requirements to the premiums. And with ICHRA, conversely, you are not offering the health care as the employer group. What you're offering your employees and your employer-sponsored offering is reimbursement dollars that your employees can then use and go out on the ACA marketplace, the open exchange, and purchase their own individual medical plan and have more, as I mentioned, freedom and choice and kind of autonomy behind that purchasing decision and select from all the various carriers and the various plan designs from those particular carriers that they will be able to access with their local or, their state or their federal exchange.
Great. Well, thank you for that overview. Now, you work with many employers and industries that are similar to ours. What trends are you seeing in health benefits for small and maybe mid-sized employers, particularly in retail or other service industries?
Absolutely. And so I mentioned a second ago, ICHRA has become not just a shiny new trendy object anymore, but more of a viable strategy and a long-term benefit strategy for employer groups of all sizes, particularly a lot of our small clients that we work with. We have some data showing year-over-year growth in all industry sectors and all business sizes in ICHRA adoption. So it's here to stay, and it's showing it's yielding results for our employer groups to become a more stable option when offering employee benefit strategies that still helps them differentiate themselves in the market with recruitment and retention. I'll give you, the reasons why. With a traditional medical plan, as I mentioned, locked in for that 12-month policy period most times. And what happens every 12 months when it comes time to renew? They're going to look at how much premium dollars you paid into the plan and how many claims dollars were paid out by that insurance carrier. And if there's that deficit or that gap, what's the insurance carrier going to do? They're going to jack up your rates. And so, our employer groups go up against the chopping block year in and year out when it comes time to renew. With ICHRA, again, you're not offering the major medical coverage. You don't have a renewal. So a lot of the group administration goes out the window, and employer groups are able to develop a more long-term, 3 to 5 year strategy around their employee benefits program, without having to, again, go up against the chopping block, so to speak, every 12 months and make those difficult decisions on, oh, I've got an 18-20% increase on my renewal rates. Am I going to eat that cost as the employer? Am I going to have to pass some of that off to my employees? Are we going to change plan designs? Are we going to change medical carrier partners? So all those things really go out the window, when it comes time for, or when groups implement an ICHRA plan here. And so a lot of the flexibility, as I mentioned as well, around participation and contribution requirements. With an ICHRA plan, there is a zero participation requirement. Theoretically, our clients could initially offer the ICHRA offering to their existing employees, and nobody takes advantage of it, and it'll still be available for the rest of the plan year for future new hires or for those employees that experience a QLE, another acronym, qualifying life events, right? So marriage, birth, divorce, loss of coverage, aging off your parents' plan when you turn 26. And really, as well, a lot of flexibility and customization when we meet with our groups to strategize around that budget for what they are going to be reimbursing their employees. A lot of times with traditional carriers as well, you have to pay, as the employer is required to do a minimum of 50% of the employee-only rate, right, or the individual rate on the lowest cost plan that they make available to their employees. With these small employers who aren't under the employer mandate to make the coverage affordable, they can actually strategize a budget for their employees that meets their specific budgetary needs. So a lot of customization and flexibility that makes these attractive and kind of less barriers to entry for, groups that may have, offered a group plan in the past, but it became unaffordable, or even groups that, have wanted to for a while and implement a group health insurance strategy, but those barriers for entry with participation and contribution requirements have prevented them from doing so. And ICHRA opens those doors for them.
Great. Well, thank you. So we've talked about cost and flexibility. How about many small businesses worry about the paperwork? What kind of administrative burden are we talking about here? Is there something an owner or manager could realistically manage?
Absolutely. So part of the Decisely value proposition is our initial sales strategy and meetings and discovery with our clients to solve for their problems, of which paperwork often comes up. And so part of the Decisely value proposition is we are an insurtech firm. Okay, so a little cute buzzword in the industry, but it essentially means we're a national benefits brokerage firm, but we also have the technology to support and the service model to support each and every one of our clients. So where paper is a thing of the past, we bring all of our clients onto a digital and electronic environment with our online and secure platform. So everything that the employer groups would need to sign off on, and even their employees when going through and enrolling or waiving the benefits, is all done with clicks and keystrokes on our electronic platform. Not only for the open enrollment and the initial, offering and setup and implementation, but ongoing service throughout the year. That is through our self-service technology. But we also have a team of individuals that can help out and are assigned to each and every one of our clients to facilitate and really take that HR burden off of the business owners themselves.
Great. So we've covered the workload for employers. Now let's talk about the people that this benefits the most, the employees.
Mhm.
How do ICHRAs affect employee satisfaction or retention? And what support helps them choose the right plan for them?
Yeah, it's a great question. And so with our value proposition here, we are still seeing the recruitment and the retention aspect of employers wanting to differentiate themselves in the market be on par with a traditional major medical plan with our groups that are implementing ICHRA. From a employee standpoint, I mentioned the fact that they have more freedom and more choice with their healthcare selections. Again, as opposed to the employer handpicking the carrier that they partner with, and the 1 to 3 medical plans typically with our clients that employers are limited in scope to offering. immediately these employees are presented with more options through our integrated shopping experience that we offer. So it's not just the selection of the ICHRA plans and the benefits that Decisely helps out with. We actually walk the employees through and hold their hand or shepherd them through the entire shopping and actually purchasing of their medical plan experience. And so, as opposed to the one carrier, and like I said, the 2 to 3 medical plans, maybe they're presented in the old traditional model. With an ICHRA, they're going to see all of the medical carriers and all of the plan designs from those medical carriers in a very user-friendly shopping experience that allows them to filter down by metallic coverage tier level, by premium amount, by deductible amount, even by network type or carrier that they want to partner with. Plus, there's live enrollment support, as I mentioned, to shepherd them through that entire process. So that can be engaged with a phone call, live chat while you're doing the shopping experience with a licensed representative, or even email communication. However, the employee chooses to leverage those options. But the point is, from A to Z, from selecting the actual benefit offering that their employer is rolling out to them, to actually purchasing their medical plan, we help shepherd the employees through that experience and make it a more palatable experience for them. Because let's face it, change is always daunting, but you can't run away from change. Change is inevitable, and so we try to make it as seamless and as user friendly as possible for our clients and their employees, to educate them, provide them the resources and materials, not only through our initial open enrollment meetings, but also ongoing service and support and documentation that they can use to help answer their questions at any point in time about their benefits offerings.
Great. Oh, that sounds wonderful. And it's always helpful to see this in action. Do you have any examples of similar businesses succeeding with ICRAs?
Absolutely. So, what comes to mind is a pizza franchisee that I was working with and rolled out an ICHRA product up in Ohio. So he was under a traditional major medical plan. He had about, I'd say, 42 full-time employees last time I checked, who would qualify for the benefits. But previously, he was not under the employer mandate. Okay, so he wasn't required to offer the benefits. He did so out of the goodness of his heart, and also he knew the value of offering employee benefits as a recruitment and a retention strategy. And so, but previously, he was only offering that traditional major medical plan to his management or his leadership staff. When we had the ICHRA discussion and ultimately rolled it out, not only was he able to spread the offering and now was able to offer it to more employees, including his hourly wage earners, but we kept his costs roughly the same that he was paying, out of pocket as an employer with that traditional major medical plan. So more availability to benefits and more offering the coverages to more employees, which helps recruitment and retention, but also keeping his costs and his budget the same. So it was a win-win from that scenario.
Great. And I just want to reemphasize, he was a good mid-size employer, but this is good for if you've got one, two, or just a handful of employees, correct?
Absolutely, absolutely. And so a lot of the burdens, as we mentioned previously, for small employers is meeting that minimum participation requirement with trying to roll out a traditional group plan. Typically, you need to have at least 2 unrelated individuals, but a lot of carriers require on top of that at least 50 to 75% of your eligible population to enroll in the group coverage, minus those that have valid coverage elsewhere, like spousal or under their parents' plan and things like that. But 50 to 75% participation to even get that plan off the ground and offer it, in the future to future new hires or things of that nature. With ICHRA, there is zero participation requirements. So those barriers for entry are a thing of the past with ICHRA, and just case in point how it works for employer groups of all sizes.
Great. Thank you so much. Well,
Absolutely.
all of this is fabulous to know. So I want to wrap up with one key takeaway that you want members to remember about this program.
Absolutely. And so it revolves around the benefits not only for employers, but also for the employees themselves. And we've talked about all the topics here, Caprice, but flexibility and predictability for the employers, right? It's more of a long-term strategy because you're not offering the healthcare. You don't have a renewal every 12 months where our employer groups are having to make those decisions like we talked about and kind of go up against that chopping block. So more predictable, longer-term solution here from a cost and a budget standpoint, and the flexibility that comes with the no minimum participation requirements and no minimum contribution requirements at all, especially for our smaller employer groups where cost was a huge consideration. And then for the employees, again, back to the freedom and the choice. They own that medical plan. They're making that decision to purchase that medical plan independent of their relationship to their employer. So if they ever leave the organization, they can just keep paying the premiums on that major medical plan, and it's portable. They can take it with them. And again, choice. They're immediately going to be presented. Wherever you live across the nation, you're immediately going to have more options for the employees to select from, more carrier options and more plan selections to choose from, so that employees can have more autonomy and control over their health making decisions there when it comes to buying a major medical plan for their own personal family situation, their needs, their budgets, their doctors and facilities that they want to and currently go to. Which overall, again, to sum it up, has these similar tax advantages for employers as well, as do traditional medical plans. So flexibility, predictability for the employers, and freedom and choice for the employees would be our key takeaways from today, Caprice.
That's great. Branson, thank you so much for sharing your expertise today. And for our members, you can find more information at myhfa.org or contact our office at 1-800-422-3778. Thank you for spending your time with us today, and we look forward to helping you save money and time on your health insurance.
Thanks for having me, Caprice. It was a pleasure. Take care.
Thank you.